Welcome, everybody. I'm Alex Huffman. I'm the Assistant Director of the Department of Supportive Care and Integrative Oncology at the Cancer Center. And we're so glad you were able to join us for our monthly Lunch and Learn series. I recognize many familiar names on the attendee list, so good to see many of you back. And welcome to those who are joining us for the first Lunch and Learn session. We hope this is really informational for you. Please, if you would, put any questions you have in the chat, and Minda and I will make sure to get to those at the end of her presentation. And just a reminder that this is being recorded, and the recording will be sent to the email you used to register probably mid next week. So keep an eye out for that, and you'll be able to refer back to it. And the last note I have in terms of housekeeping is just that this is an informational session. We really want it to be as beneficial to you as it can be. Minda will not be able to answer any specific medical questions based on your treatment, but we will very much try to get you some general answers to questions that you have. And of course, we'll refer you back to your clinic if you do have specific treatment questions. So on that note, I am thrilled to welcome Minda Hill. I've had the opportunity to work with Minda for many years now, so it's great that we are together today again. Minda is a B.S.N, RN, and OCN. She's an oncology certified nurse here at the Cancer Center at UT Southwestern. She graduated from the University of Texas at Austin in 2014 with a Bachelor of Science in Nursing, and she joined Harold C. Simmons Comprehensive Cancer Center at UT Southwestern right after that in 2015. And she has been here and had the opportunity to expand her experience and knowledge within the Cancer Center. She's held many positions here, including bone marrow transplant as a clinic nurse, our infusion clinic as an infusion nurse, the gastrointestinal clinic as an oncology nurse navigator, and now has moved into the position of program manager for the pancreas cancer program. With her clinic experiences and understanding of processes, she's passionate about improving and transforming patients' and caregivers' experiences through the trajectory of their cancer journeys. And on a personal note, Minda lives with her husband, Michael, and beautiful 4-year-old daughter, Lucy. She loves traveling, snow skiing, gardening, exercising, and having a good book in hand. Love it, Minda. So thank you again for being here, and we will turn it over to you now.
All right. Thank you so much for the wonderful introduction. So hi, everyone. Again, my name is Minda. Today, I will be going over how to prepare for chemotherapy, and will provide you with some tips and tools you can use during this time. So just a little bit of an overview of what I'll be going over. We'll talk about chemotherapy, what is chemotherapy, and how do we prepare and what to expect. Some common side effects. We'll go over a handful of those and tips for those symptom management. And then we will talk about some research and support. So let's start from the beginning. What is chemotherapy and why do we give it? So chemotherapy is a type of cancer treatment that uses strong medicines to kill cancer cells. It works by stopping the cancer cells from growing and dividing. So think of your body as a garden. Cancer cells are like the weeds that are growing out of control, and the chemotherapy is the special spray that helps kill those weeds without harming the flowers or the healthy cells. However, just like some of the special sprays can sometimes harm the other plants, chemotherapy can affect some of these healthy cells. So that is why you might see some of the side effects, and we'll talk about some of those a little bit later. So chemotherapy is given in various ways. It can be an oral pill that you take by mouth. It can be intravenously, so through a vein, or it can be given by injection. And chemotherapy is given in cycles. So you'll have treatment periods and rest periods. And the number of cycles depends on your diagnosis and is determined by your care team. Chemotherapy can be given alone or in combination with other modalities. So you'll see maybe surgery, radiation, or immunotherapy added to your plan of care. And then once your team decides your plan of care, your treatment will be scheduled. So we have 4 locations at our Simmons Cancer Center. So you'll see here we have the Cancer Care Outpatient Building in Dallas. That is in the upper left-hand corner. We have Richardson Plano, which is the right upper hand corner, Moncrief and Fort Worth, which is the left lower corner, and Redbird, that's the picture in the right lower corner. All of these locations are open Monday through Friday, and our Dallas location at the Cancer Care Outpatient Building is open on the weekend for services. So no matter where your provider is located, you may coordinate infusions at any of these sites. So sometimes patients will have their provider in Dallas, but you live closer to Richardson, Plano, that is okay, and we'll work on coordinating what works best for your schedule. So what do the rooms look like, and what do you need to bring? All of our infusion sites have the private rooms, so you'll see there on the left-hand side, and we also have the community areas. All of these are equipped with amenities, so you are comfortable during your infusion. We have the reclining chairs, complimentary Wi-Fi, and smart TVs. Mostly patients are seated in the private areas, but there's occasional times where if you have a shorter infusion, you may be seated in a community area like you see. It's an open area and you may be seated by other patients. If you do get scheduled in a community area, you will be notified in advance, so you'll know that ahead of time. We do allow one guest to sit with you during your treatment and your first infusion. We do encourage you to bring someone with you so they can help drive you to and from. And then for future treatments, depending on the medications you receive and how you respond to them and your overall health, you may be able to drive yourself. So next, we'll talk about what to bring. So we encourage you to bring books, snacks, a blanket, your iPad or laptop, anything that makes you most comfortable. I've seen patients bring in rolling luggage of their belongings. So don't be nervous to bring whatever makes you comfortable during this time, especially if you do have one of those longer treatments. At our Dallas location, we do have the Simmons Bistro on the 3rd floor, and you can order some of those snacks and meals to be delivered to your room. That is open during the week, but not on the weekend. And then we also have those nutrition areas in Infusion where you can grab some snacks, but we encourage you to bring your own snacks as well. So types of vascular access devices that we use to give the chemotherapy. So for easy access to your bloodstream for the chemotherapy, blood draws, or medication administration, you may get a Metaport or a PICC line inserted in your chest or arm. These are surgically placed by our interventional radiology team as an outpatient procedure. These types of vascular access can be in place for weeks to months. So depending on chemotherapy you're getting, your treatment team may require you to have a line like this. If your treatment does not require a Metaport or a PICC line, your nurse will place an intravenous catheter in your hand or arm, and then they'll remove it at the end of your infusion. So just a couple of quick tips here. If you do have a Metaport, we use the term accessed, meaning kind of in the picture you see here, it is accessed, so the needle with the catheter attached. Most people describe whenever we access your port, it to be just a pinch. But if that does bother you, you can ask your care team to prescribe a lidocaine cream. So what you'll do with that, if you do have that cream, is before you leave your house, you can apply a generous amount or glob of that cream on the area of your skin where your port is. It'll look like kind of toothpaste consistency. Place a small piece of saran wrap to cover just that area and leave it there under your shirt. And then when you get to the infusion site, the nurse will remove it for you, clean it up, and then they'll access it. And sometimes with that little bit of lidocaine, people say they don't feel much at all from that needle. So just a little quick tip. Some people don't need it at all, so just wanted to add that in there. For a PICC line, has 3 lumens, or they look like tails that stick out from your upper arm. And they do make sleeves that kind of contain it. So then when you're up and moving about your daily activity, you can kind of put that sleeve on and it'll move it out of your way. I would encourage you to bring, if you buy your own sleeve or if you're given a sleeve in Infusion, to have them show you how to properly put them away and put it on, so you don't kink the lumens. So you don't want to always have that on. You want to give it some rest time so it doesn't mess up your PICC line. All right, so moving on, just kind of what does it look like the day of your infusion visit? So the amount of time needed for your treatment varies for each person and depends on your treatment plan. Your care team will give you an overall idea of the duration of your treatment. Each infusion visit consists of that lab draw and verification of the blood test results. And then your oncology certified infusion nurse will assess you and verify the treatment orders that are signed by your provider. And once they've done these assessments and the treatment is approved, they'll release it to the pharmacy. And that's when the pharmacist can begin preparing the medication. Some of the medication have to be thawed or dissolved or mixed, so it can take up to about 30 minutes. But while this is happening, the infusion nurse begins to administer fluid to hydrate you and pre-medicate you and prep for the chemotherapy. And then once the pharmacy dispenses the chemotherapy, 2 nurses will come into your room and they'll verify the medication independently, and then they'll start the infusion. So quick tips here to kind of speed up your day or decrease your wait time. You could get your labs drawn up to 3 days prior to your infusion visit, and this can be done at any of the UT Southwestern locations. So let's get back to our garden. I mentioned at the beginning of our presentation. So the special spray that I talked about that we use on the weeds or the cancer cells, they can affect some of the plants surrounding, so the healthy cells. So we start to see some of these side effects. So let's discuss some of the side effects we commonly see and how we can support you to manage them. Just as a reminder, you do have an interdisciplinary team that consists of your oncologist, your clinic nurse, dietitian, we have a nurse navigator, infusion nurse, and more that all work together to make sure you have a personalized treatment plan, care plan, and make sure that any symptoms that you might experience are managed. So just know that we're all here to support you. So one of the most common side effects is fatigue that comes on suddenly and is not relieved by rest or sleep. So you may notice low energy level and the need to rest after normal physical activity, overall weakness, difficulty completing daily activities, or concentrating or thinking clearly. So some of the things that we can do to manage fatigue are scheduling activity when you are likely to have the most energy and feel your best. So listen to your body and try to be active after maybe a nap or rest, and try to incorporate walking, gentle yoga, or stretching into your daily routine, and stay well hydrated and try to eat a balanced diet. And you'll kind of see a theme of some of these same things that are tips for all of these symptoms. So loss of appetite. Cancer itself and its treatments can affect your appetite. It can also change the body's ability to tolerate certain foods and use certain nutrients. So working with your oncology dietitian is really important, so they can assist you in making informed choices about your nutrition and create a personalized plan based on your needs and your diagnosis. Weight maintenance and having adequate food intake during cancer treatment is important to avoid any of those delays or dose reductions in your therapy. We understand this can be difficult when you have a loss of appetite, and the loss of appetite is often related to other symptoms such as nausea, diarrhea, and dehydration. So tips for management of loss of appetite. So first, we want to manage the underlying symptoms that may be causing the loss of appetite. So the nausea or diarrhea, which we'll talk about in the next slides. Viewing food as medicine. You might not be up to eating, but we need food for survival. So thinking about it as a necessity more than just for pleasure. And creating an eating routine or schedule. Sometimes eating at the same time every day can encourage the stomach to produce the hunger signals and create a better appetite. And if you can't tolerate eating much, focus on eating more caloric dense foods and liquids, and try to drink fluids in between meals. So next we have nausea and vomiting. Nausea with or without vomiting is a common side effect of chemotherapy. It's important to keep your nausea under control because the inability to eat or drink adequately can cause weight loss and dehydration. Nausea can occur on the day you receive treatment and can last 3 or more days after. You will be given those pre-medications before your infusion that will help with the nausea, and then typically your team will send home 2 other medications that you'll take by mouth that can be alternated to help with the nausea. We encourage you to take these ahead of feeling nauseous and try to stay ahead of it and not wait until you already feel nauseated. You want to stay in front of it so you do not vomit. You will also want to take these medications with something on your stomach so it doesn't exacerbate the nausea. So maybe some crackers or toast. So additional tips to manage or minimize the nausea, you'll see here, eat 6 to 8 small meals a day instead of the 3 larger meals. So try to graze throughout the day. Eat during the time of day when you feel least nauseated. So sometimes we encourage taking your nausea medication and then waiting about 30 to 45 minutes and then try to eat at that point. Eat sitting upright and do not lie down for at least 1 hour after eating. If food odors cause nausea, prepare meals that do not need to be cooked. So using lunch meat, yogurt, fresh fruit, jello, crackers, cereal, any of those. And eat bland foods that are sweet, fatty, greasy, spicy can aggravate the nausea. And then you'll see on this slide, I did include the ginger tea recipe that we have on some of our handouts that can help settle your stomach. And again, you'll get these slides at the end, so you'll have these. All right, moving on to diarrhea. We consider diarrhea as having loose or watery stools 3 or more times a day. Many of the chemotherapies we give do cause diarrhea, so it's important to manage because uncontrolled diarrhea can lead to weakness, dehydration, poor appetite, and any weight loss. Your doctor and care team will prescribe some anti-diarrheal medications, and you'll just take those how they prescribe them. And if you continue to have diarrhea after taking the medication, you will need to call the clinic and they'll address that concern. On this slide, you'll see some what to do and what to avoid. I'm not going to go through these today, but you can see here and take a screenshot. And again, we'll share these slides, but some helpful tips here. Constipation. Some chemotherapy can cause constipation, so the whole other opposite. Constipation means being unable to move your bowels for 3 or more days. It can also mean having bowel movements less often than normal than you're used to, or having to push harder than usual. So being less active than usual, eating or drinking less than usual, or taking certain medications can cause constipation. And keeping your bowel movements regular and easy to pass is important. So tips for management. We want you to eat at regular times each day. Try to drink that fluid, 8 to 10 cups. So hydrate, hydrate, hydrate. Again, that's kind of our theme in a lot of these side effects, and our next slide we'll talk about dehydration. We want you to establish a bowel plan with your care team, and it may include fiber supplements, stool softeners, or laxatives, and try to exercise regularly to keep those bowels moving. We want you to call your doctor if you are having intense abdominal pain, excess gas, or bloating that is not improving with the medications that they give you. You'll see here that I included the Honey Brand prune muffins. That is a high fiber muffin, but that might be useful. But I do want to note, if you are including a more high fiber foods in your diet, to make sure that this has been recommended by your team, and talking with your oncology dietitian to determine the right amount of fiber for you, depending on you and your diagnosis. So dehydration, it is very, very important to drink plenty of fluids during your cancer treatment. Dehydration can happen fast, especially if you are vomiting or having diarrhea. To get enough fluids, it's important to drink even when you aren't thirsty. So why is it important to hydrate? Water in your body removes waste and toxins. It transports your nutrients and oxygen. It controls your heart rate and blood pressure, regulates your body temperature, lubricates your joints, protects your organs and tissues, and it promotes saliva production. So all very, very important things for your body. So again, hydrate, hydrate, hydrate. And some tips to stay hydrated: try to drink those 8 to 10 glasses of clear liquids throughout the day, even when you don't feel thirsty. You can even set alarms. Sometimes that can help just motivate you. Take a water bottle along whenever you leave home. And if you're like me, sometimes getting a new water bottle can be motivating. I don't know why, but it is. Add foods to your diet that includes fluid, such as soups, broth, popsicles, and jello. And you can try infused flavored water just to add a difference in taste, to encourage you to drink some more water. You can just gather fruits, ginger, mint, or any combination of these ingredients, just muddle or smash them, and then add them to your plain water. And I think there was a question that did pop up about coffee. We'll say here, if you don't want to miss out on your coffee and are wondering about if the caffeine is okay, it is. Caffeinated drinks do have a mild diuretic effect. So we just suggest a moderate intake. That does not appear to increase the risk of dehydration. So you can have your coffee. Some chemotherapy can cause sores or dry mouth. It is important to look in your mouth every day for redness, ulcers, or any white patches in your mouth or on your tongue. You may notice mild dryness, decreased saliva, or even difficulty swallowing. And managing dry mouth and having good oral care is important to reduce your risk of dental cavities, gum disease, or getting mouth infections. So some of the tips for oral care during treatment: we want you to brush your teeth, gums, and tongue with a soft toothbrush and toothpaste that has fluoride after every meal and at bedtime. We don't want you to use mouthwashes that contain alcohol. These can make mouth dryness worse. So you'll see here on the right a homemade mouth rinse that has half a teaspoon of salt, half a teaspoon of baking soda. You'll mix that in some warm water, and you can swish in your mouth for about 30 seconds and then spit. So we would rather you use that mouthwash than anything that you find in the store that has alcohol. If your dentures don't fit properly, we don't want you to wear them. We don't want them to cause any more harm to your mouth. And if your mouth is sore, choose soft foods that are easy to chew and swallow. And if you develop mouth sores that are causing discomfort and or decreased ability to eat or drink, we do want you to call the clinic. So hair, skin, and nails. You can have hair loss so you can have hair loss, hair thinning, or a change in texture. Hair loss can begin 7 to 21 days after starting treatment, and that is usually temporary while you are on treatment. Your hair, when it does grow back, it may grow back the same, or it might have a different color or even texture. We want you to call your clinic if you notice any new rash, blisters, or skin peeling. And we want you to try to avoid long exposure to sunlight and use that SPF. Use mild soaps to avoid any irritation and moisturize your skin with hypoallergenic lotion. For your nails, we want you to gently trim or file your nails, and we do not usually encourage professional manicures or pedicures unless approved by your provider. So at UT Southwestern, our goal is to help you look and feel your best during and after treatment. We have partnered with a nonprofit organization called Sweet Hope. They helping oncology patients aesthetically. They provide many services are listed here, such as treatment for skin and nails and assistance with wig selections. It's such a cool opportunity that we have to help our patients. So to schedule a consultation, you'll contact the founder, Gianna Doyle. She is a licensed cosmetologist and medical aesthetic provider with special training in oncology, aesthetics, and corrective makeup. So chemotherapy can affect your bone marrow that produces your blood cells. Your body consists of red blood cells that help with oxygenation, platelets that help with clotting, and white blood cells that protect your body against infection. After chemotherapy, your blood cells usually recover on their own within 10 to 14 days. Sometimes your provider may prescribe an injection to boost those white blood cell counts. And you may even receive blood infusions if you need those. When your white blood cell count is low, you are at an increased risk of infection. So how do we prevent and protect ourselves from infection? We want to avoid people who you know are sick. We want you to wash your hands often with soap and water. Avoid getting cuts or breaks in your skin. Wear gloves when gardening, bathe, shower daily, practice good mouth care, and we want you to monitor your temperature, and we want you to use an oral thermometer. If your temperature gets to 101, we want you to go to the ER. If your temperature is 100.4, you can wait an hour and monitor. And if it maintains, after that hour, if it maintains 100.4 or higher, you should go to the ER. We do want you to avoid over-the-counter medications that may mask a fever unless approved by your provider, and avoid enema or suppository unless approved by your provider as well, because we don't want to introduce any harmful bacteria. So we do offer acute care clinic that offers same-day appointments for our established Simmons cancer care patients that are experiencing some of the side effects or cancer-related symptoms. I'm so sorry. Some of these symptoms, they're urgent attention. They need urgent attention, but we do not think they're immediately life-threatening. And it's kind of, I'm so sorry. As your cancer care providers, we want you to visit an emergency department. We don't want you to visit an emergency department if it's not needed. So we have this acute care center that will assess and give you fluids or anything that you may need here at our cancer center. To schedule an appointment, your oncology team will coordinate appointments and notify staff that they should expect your arrival. And if you are unable to reach your oncology team, you can call our Hope line. So that is there, the 214-645-4673. number, and they will give you additional assistance and help connect you with your team and get you coordinated for a visit here at the Acute Care Center. So lastly, I know this was a lot of information, just bundled up in a good 30 minutes. So we understand that this can all feel very overwhelming, whether you are newly diagnosed or in survivorship. I want to highlight that including your clinic team, infusion, pharmacy teams, you have a large supportive services team that surrounds you. We know how cancer can uniquely affect many areas of your life. So our goal is to make sure we're addressing each of your individual needs. To reach this goal, we have our specialized support services staff on hand. So you'll see we have nurse navigation, cancer psychology, oncology, nutrition, or our dietitians, social workers. We have cancer exercise, spiritual support, music therapy, integrative therapy, and we also offer classes and meetings and appointments focused on specific issues that you might be experiencing. So please, please, please reach out to any of our team members so we can help you navigate the resources that we have and resolve any challenges that you may be facing. And again, we are here to support you. So thank you for your time, and I hope this was really helpful. Thanks.
Awesome. Thank you, Minda. We're going to get into your questions now. So if you have not had a chance to put yours in the chat, please go ahead and do so. Whoops, my chat went away. Hold on. There we go. So our first questions, Minda, general recommendations for what's safe when on chemotherapy. So for example, is it safe to drink alcohol when you're on chemo? Get your vaccines like your COVID and your flu when you're on chemo? Go out into the world where we have group gatherings and settings like big events and things like that. What is the general recommendation?
So for a lot of those, usually I would talk directly to your clinic teams, because I think based on diagnosis, it can be really different for everyone. So I hate to give kind of a general answer for that. It would be best to talk to your team.
Okay, and this might have the same answer. For the immune system to kind of return to normal after a chemo treatment, what is that window?
Yeah, that's dependent,
Kind of the
different
same,
for,
yeah.
kind of different for everybody. And I think just not even by diagnosis, I think it's very just unique to you and how your body recuperates and goes back to normal. And that sometimes that's why you may get that boost injection that helps that white blood cell count and stimulate. And some people don't need that. So it just varies.
Sure. Okay. So recommendation to go back to your care team so you can get the best answers for you. Question about cold caps. Who are cold caps recommended for, and what do we know in terms of hair loss prevention?
That is a good question. I know we have, I feel like you should talk to your provider on that one too, but we have a lot of our patients use cold caps. We're okay with you using them, and I think there's outside organizations that can help kind of coordinate what to do and what to bring and how to do it. But I don't think there's like a special diagnosis that uses it over others. You can just talk to your provider and see if that is something that could be useful for you. Some providers may not encourage it as much, but I think it's okay.
All right, so check back with your care team on that one too. I know our breast cancer clinic is probably the largest user of cold caps, but I think that's more of just the population in that clinic. So note to make sure you're asking your care team about your specific questions. In terms of wig references, so we had our great slide. Thank you for that, for mentioning Gina's fantastic volunteer work with us. But can you talk a little bit about prescriptions for a prosthetic wig and the process of doing that?
Yeah, I haven't done this process in a long time, but we do have where it's kind of like a prescription for medication. We put that order in and we can even print that and give it to you, and you can take it to an outside location that has wigs and they can help you get one.
Absolutely, yes.
Yeah, and I think Gianna is the best if you are having those issues, or your social worker can kind of maybe help you navigate that as well.
Absolutely. Yep. Our social workers often help get that referral to you and go through that process. Definitely recommend you call your insurance because some insurance companies cover more than others, and they may tell you specific wording that would be helpful to have on your order for approval. There's some great wig boutiques in the Dallas-Fort Worth area, and the folks that work at those boutiques are absolutely phenomenal too. So you can always go in one of those and ask for some guidance, and they'd be able to help you too. But the prescription comes from your oncologist. So that question was noted as well.
Yeah.
Minda, any research you're aware of on light therapies for hair and skin
I'm
reactions after
not.
treatment?
Yeah, I'm not. Maybe some of our oncologists are that see that more often. I don't know, maybe Gianna would be someone too that has looked into that, but I am not. Unfortunately, I don't know anything
Yeah.
about that.
Okay. Could you help explain the difference between immunotherapy and chemotherapy?
Yeah, so chemotherapy, we give medication to kill the cancer cells. Immunotherapy helps your immune system fight the cancer cells. So hopefully that was kind of a basic answer, but hopefully that helps.
Thank you. And I know we're jumping all around, but our next question is an important one on palliative care. When would a patient potentially be referred to palliative care services and the differences between what the palliative care clinic offers and hospice care?
Okay, that's a question that we get frequently. And I think palliative care, we're trying to encourage that this is kind of early on in your treatment, and this is not something that is later. The earlier that palliative care is involved in your care, they're kind of work in parallel with your oncologist and help manage your symptoms and just help you live to your fullest. So they're really good help to work with your oncologist. So they work in parallel, and I encourage doing that early on in your journey. And then hospice care is very, very different than palliative care. Hospice care is at the end of life. It's usually the last 6 months and help with providing you comfort only. So you would not have any medical intervention. And Alex,
Yes.
you can chime in to.
You explained that beautifully, and I would just add that palliative care is truly the art of symptom management. So that expert team really looks at symptom burden and how to best manage exactly to what you said to get the most out of life, the most quality of life that we can offer you going through cancer treatment or truly any other significant treatment. So absolutely encourage that. And as you said, the sooner, the better, and can be great for complex care and for next step decisions. So if you find yourselves at a crossroad, that team can often help with that too. One more question that's pretty specific, Minda, about the PICC line in addition to the Mediport. Do those two things exist for every patient that gets them?
No, so you will have one or the other, and that is just based on what is needed at the time. There's a lot that goes into the decision between a PICC line and a Mediport, and that's just between the patient and the provider. So they're just two different central lines that you may see.
Got it. Okay. And I see here some questions about specific protein powders. And I don't know, Minda, if you have any. I was going to immediately encourage that anyone interested in guidance in terms of protein management and recipes, powders, consult their dietitian. But Minda, what other ideas might you have?
So for trying to get those calories, our dietitians will encourage some of those ensures and boosts and any nutritional supplements. You can make protein shakes. So yeah, working with your dietitian is best, and they can figure out which ones will work best for you, because some of those shakes, some are higher in sugar and different things that they're looking at. So it's best to work with them so they can personalize it to what your needs are.
Right, absolutely. And I will tell you, they also get samples. So it's a great way to be able to sample some of their recommendations before you go out and purchase. So it can be kind of expensive. So highly encourage that. There's a wonderful shout out in the chat to our dietitian in Fort Worth. So I will ensure that she hears that. Let's see. Recommendations for bone cancer in pain management. I'm not sure, Minda, that's an area you can weigh in on much, but in your experience, guidance on that for patients that are going through a bone cancer treatment or metastasis.
Yeah, that I feel like that's why it's important to work with palliative care and your oncologist. They can prescribe things that will help. We do have a pain clinic if they need to refer you there. So there's some options. Your oncologist, palliative care, or pain clinic might be some of those.
Yeah, and I think that the pain clinic is extremely helpful for our patients who have, multiple pharmaceuticals to manage to get in with the pain specialist there. All right, I think we have answered the questions that I see. So we'll wait just a minute because we do have a little more time for anyone that wants to throw another question in the chat for Minda. But Minda, we appreciate all of the information that you've been able to offer us today. And while we wait, I'm going to plug our November Lunch and Learn session. So we hope you'll join us, and you will now that you've registered via email. You'll get some information about future sessions. But our November's Lunch and Learn series will be on caregiver support. So our clinical therapist, Dinah Foster, who specializes in caregiver counseling, will be offering that. So we hope you will join us and encourage you to spread the word to those on your care team if you're the patient that may benefit from that time together. So question about generally to talk about the caregiver's role. I'm again going to refer to that November Lunch and Learn. But Minda, you have seen caregivers, alongside patients. Can you talk a little bit about the roles you've seen caregivers take on for someone going through cancer treatment?
Yeah. So yeah, they'll talk about a lot in the next month. But our caregivers are just as important as our patients. And I've seen caregivers just be right alongside of our patients. So just emotional support, driving our patients, taking care of them at home. A lot of questions are, what can I cook? What do I make? Just feeling hopeless and not knowing how to be there for your loved one. So they play a big role in the journey. So it's all different for everybody, and yeah, but big role that they play.
Huge role, huge responsibility on the caregiver. To your point, sometimes that is more of a medical management assistance. There might be a wound care and appetite help and things like that, medicine management, making sure patients stay on track with all those things. But absolutely the emotional support, managing the appointments, being the historian for the medical team, because it's really hard for our patients to be able to really process everything they're going to and report it back all at the same time. So, but again, join us in November for some really, really great content on those various roles and in ways that we can support caregivers and self-support too. Question on palliative chemo. Can you speak to what palliative care chemo is?
Yeah. So I think this is what you're referring to when you say palliative chemo. Something that is not curable in your staging, and just making sure that we're managing the cancer where it's at. And sometimes that can also be to make sure you don't have pain. I know it sounds weird giving you chemotherapy that can cause all these other symptoms, but sometimes it does stabilize your cancer enough where you can live a full life.
Okay, lots of good questions coming in now. So we'll hang on with you for a little bit, Minda. But one is, can we go back over the acute care clinic, what the role is of the acute care clinic and where it's located here in the Cancer Center?
Okay, so I kind of got jumbled up on the acute care slide. I'm sorry. So our acute care center is something that we brought in when we have built the new cancer center, and it was built to keep our patients out of the ER as much as possible. So oftentimes you get sent to the ER and you're dehydrated and need fluids, you need blood, you just need a little bit more support. So we try to do that here in the cancer center instead of sending you to the hospital. Our acute care center is located on the second floor, and it's when you walk into the lobby, it's on that floor, and they can direct you to, it's kind of on the side.
And I'll note it's appointment only, so your oncology clinic will set up an appointment for you if you need to go to the acute care clinic. So it's not a walk-in clinic like an urgent care in the community, but it's here in the cancer center to help with the symptom management. Let's see. Recommendations for patients the day after chemo. Can a patient be home alone after a treatment, or do we recommend they have somebody with them?
I would think for the first infusion, kind of like having someone with you at your infusion. I think it would be helpful to have someone with you at home, just because you don't know how you're going to feel and how you're going to respond at home. So having someone there just for extra support and making sure you're staying hydrated and helping just with those things, just to see how you do that first time. If you feel like I can manage this moving forward, you can make that decision.
Okay, and then our last question that I see is just on the difference in how individuals respond to treatment. So do we see any difference in demographics like male versus female, or anything that would set a patient up differently for the same treatment? Do you have any data there?
No, yeah. I think it's very diagnosis dependent too. There's all that data that you can find on your diagnosis, but treatment wise, no, I don't think, or I don't know.
I mean, I think generally when we see one person go through that chemo treatment, we see that one person go through that chemo treatment. It is so different sometimes based on also just a person's kind of physical ability level too. So, okay, and let's see. A question about the arrangement in the room for a patient that might have several hours long chemo treatment. I know that we showed a video there, but can you talk about that chemo chair that's in the room that a patient would be in for long treatments?
Yeah, so they're kind of a wider, I've sat in them, and they're kind of a wider chair, and they do recline, and they recline pretty far back. So it's almost like a bed. When you extend it back, it's not a bed that we have in any room, but we do have those recliner chairs. And then when you do have a guest, they have kind of a chair or a love seat size side chair. but no beds, but those reclining chairs. And then we do have some blankets and things. And a lot of patients do take that time with those several hours to nap and get their rest. So
Absolutely. And we have
yeah.
those window screens that you can drop down and, make that room a little bit darker too. Okay, I think, Minda, we have covered the majority and a ton of questions and a ton of content. So thank you so much for being with us today. Just a reminder, you will get this recording. It tends to come out usually mid next week. So just keep an eye on it. It'll go to the email you used to register for today's Lunch and Learn. And we absolutely hope you will join us next month with Dinah Foster to talk about caregiver support. So thanks again, Minda, and I hope everyone has a wonderful rest of your Friday and a nice weekend.
Thanks.